press record over here. So everybody who watches the video usually gets a bit of a prelude beforehand. They actually get, sometimes I stuff the intro up, but not always. And this is my third interview this morning. So I did one at 6 a.m., 7 a.m., and this is now 8 a.m.
Wow.
And of
Hope you have
course,
some coffee.
I've had two already, but it was beforehand, like last night. I just couldn't sleep. Just could not get to sleep. It's like when you're going to get really early for a flight. And
You said that last time we talked. We talked a week or so ago, and you couldn't sleep that night either.
Yeah, it was the same thing because I just wanted to make sure I didn't miss getting up. And what was funny, I then set my alarm, and then I'm asleep. I must have finally fallen asleep, and all of a sudden it clicked. Shit, I set my alarm for the wrong time. So it woke me up. And yeah, so it was good. Anyway, I'm going to get into the introduction, and here we go. Hi, I'm Tyson Franklin, and welcome to this week's episode of the Podiatry Legends podcast. With me today is Dr. Don Pelto. He is from Massachusetts, USA, and he loves management. He loves marketing, also loves being a podiatrist. And we are going to talk about, how do I put it? About practice mastery. Well, podiatry practice mastery is what we're going to talk about today. So, Don, how are you doing?
Hey, Tyson, thanks you for inviting me to the show. I'm doing great. We're the opposite time zones. You're at 8 a.m. I'm about 5 p.m. So I'm just finishing up the day here in the office. So thanks.
So that background, if people are watching the video, that's not your office there. That's a fake background.
It is. And I use a fake one because my office, you would see my kids' artwork behind me and all the magazines I have to read behind me and these skeletal bones sitting around here. I can show it to you if you want it.
No, that's okay. It's funny. The other day I was doing a video and I did a fake background of my real background. So I'm there on the video with somebody and they said, "Is that a screenshot behind you?" I said, "Yeah, it is." They said, "Why did you do that?" I said, "Oh, because I know my wife is coming in soon and I said to her, just open up the door and just come in, just sneak behind the back and then go back out again." I said, "Nobody will notice it." And it worked perfectly. It was actually really
that's great.
funny. So, and also sometimes too, because of the lighting in here, and because I've shaved all my hair off, it gets a bit shiny. So I can actually turn the lights off in here, have the fake background, and it all looks bright. Just have the lights here on the front, and it works really well. So,
and I have one of the other podiatrists is here as well. So I'm kind of annoying him as I'm talking here.
Don't mind me.
No, we won't mind you. He can dive on at some stage if he wants to. That's fine with me. So let's get in. So we met a few weeks back, and I was on your video program, which was Podiatry Practice Mastery. That was the video program.
Yeah, interviews. Yep.
Yeah, interviews, and that was really cool. So you've started a YouTube channel where you're putting all these interviews up there. What's the name of the channel is Podiatry Practice Mastery.
Correct. So I'll kind of explain where the videos are housed are podiatry.com, which is present, which is for actually podiatric medical residency. That's where the videos are housed. Yeah. And it's kind of a collaboration with them because I think the content would be great, especially for the new doctors.
But I'm sure, so the videos, because I watched a couple of videos before I came on, so I knew who I was going to be talking to. So that link that you gave me, was that on YouTube or that wasn't on YouTube?
It is on YouTube. So I'll kind of explain. So one of the challenges when we're entrepreneurs is I have my YouTube channel.
Yep.
Which has plantar fasciitis videos, all these patient presentations we're going to talk about. And then you have practice management videos. So my conundrum was, gosh, do I really want my patients seeing all my practice management videos, or they're going to get confused with kind of what I'm there offering? Does that make sense?
Yeah, that makes perfect sense.
And so what I did is I found a collaboration with Alan, who I think you've interviewed. And
That's Alan Sherman.
Yeah, Alan Sherman. And I said, Alan, I've done, maybe 20 videos with different people I've interviewed or I've talked about different topics. And I said, hey, you want to give these to your list? And he said, he would finish and edit them. And I'm always looking for people, I call them my who's, people to do things that can help me out. So that's one way of kind of leveraging. And so he's going to edit the videos, kind of cut up those areas, and then post them to his group. And that does a couple of other things. It helps kind of build a list and things like that as well. So, and then he kind of cross promotes my Podiatry Practice Mastery. So eventually, as they're all on his YouTube, I'm going to remove them from my personal YouTube. So it's purely just a podiatry YouTube. and then this will be housed there.
Yeah, well, that makes sense, because if you've got patients coming to your YouTube channel for podiatry advice and knowledge, them then seeing you talking about practice management and marketing, and they're sitting there going, oh, okay, it's not what I came here for. So I can totally understand having them separate. I think that is a good idea.
Yeah, I don't know if it's a good idea. I'm just trying it.
Oh no, I think for your patient wise, I think it's a good idea. If all of a sudden you weren't practicing anymore and you then shifted them back over to your own name, I think, yeah, that would make perfect sense. But the way you've got it set up at the moment, I think, yeah, that makes sense.
Yeah.
See, it's not like where you could have a podiatrist who might have, say, an interest in scuba diving, for example, or barbecuing, smoking meat, where they might have something, where they've got patient videos there, but every now and then they could drop some of the videos that they have an interest in another area into that area to show patients that are more than just a podiatrist.
Yeah, you know, Tyson, what happened is it actually, my interviews didn't start out with practice management videos. Gosh, it's been maybe 4 or 5 years. If you go on my regular YouTube, I started a TV program.
Oh, okay.
And I interviewed people, and I wanted a title, and I called it Healthy Living. And we talked about health topics. So I might interview a local chiropractor. I might interview someone about intermittent fasting or other ketogenic diet or different things like that I like, or different endocrinologists. And then I started to interview a couple of people on practice management stuff, and I really liked that a lot more. And that's just why that grew more. And that's why it kind of branched off to something else.
So like everything, it just devolves, as it should.
Yeah. And you do more what you like and less what you don't like.
And that has been a very common message on this podcast. We're always telling podiatrists in your practice, what do you love doing? Do more of it. What do you not like doing? Do less of it, or stop. So this podiatrist I was talking to the other day, and he said, I finally took your advice and I'm no longer doing home visits.
Yeah.
I said, how do you
go ahead.
feel? And he said, and this is funny, I laughed. He said, it felt better than having a pee at halftime at the football.
It takes courage to do that. It takes courage to do that. It does.
But it's sort of making those decisions. Like I always knew right from the start, I didn't like ulcers. So I, from day dot, said I'd never treat one, and I never did. And if one came into the clinic, I'd very quickly tell them, don't take that dressing off, and I'd refer them somewhere else. Or if I had somebody else working with me, I would have them treat that patient. So I knew right from that, hated that. So I was never going to do it. And there were other parts of podiatry that I didn't enjoy. So I just never marketed it. If it came in, we did it. But I really focused on the areas that I really enjoyed.
I think that's great advice. One thing I learned, and I teach some of the younger residents when we train them, is I have a list of, I think it's 10 surgeries. And those are the ones I'm really good at, really confident at. And those are the ones I do. If they're not on my list, I don't do them. I refer them out, because those are everything that I've lost sleep over.
Yeah.
And so I don't like to lose sleep anymore. And so if they're not on that 10 list, I refer them out. So we have some great doctors here that do a lot of the big reconstructions and things like that.
Yeah. So I was going to say, so do you try and employ people or bring in an associate who has a skill in an area that you don't particularly like doing?
Yeah, we have a couple. We have not that I don't know if I don't like it, or I was never trained in it. Maybe
Or
that might be a better word.
So if there's a problem that you're going to lose sleep on, you have an associate that
so certain ones that they're just really good at, they do a lot of it and they don't lose sleep over it. And so we have another 3 doctors, and each of them has the special skills, and it's the best thing. Like when I refer to them, it makes them look great, and they refer some real simple things. Like, for example, there's not many people doing this new procedure called Onifix here, which is that thing where it pulls out the toenails.
Yeah.
And so no one likes to do them. And so they send them all to me. And when you refer amongst each other, it really reduces the bar to objections. There's not really any objections. The patients come and they're going to take on whatever you recommend. So even in terms of, for me, when I refer a surgery to another doctor, there's no, you don't have to, I don't know if sell isn't the right word, but you don't have to really, they're going there, they're going to have it done. Yeah. So it makes things a lot easier referring amongst ourselves.
That makes sense. So got a question for you. When you hear the term podiatry practice mastery, what does practice mastery mean to you?
Yeah, I'm still figuring that out. Okay. But I think, so podiatry, why podiatry? Because I wanted to do a niche podcast.
Yeah.
Okay. And a niche website. And I could have called it just practice mastery, but I think a lot of people, I find they're trying to do everything for every single type of practice. For example, they don't want to give up anything. I want to do it for physical therapist. I want to do that orthopedist. I want to do it for podiatrist, for dentists, for everything, because they think, and this is something that you've taught me about with some of your thoughts, but the power is the niche. So podiatry, I didn't just want it to be like medical knowledge, because I think there's a lot of really great people that are teaching medical content, and I don't think that's my area that I'm not really passionate about really teaching people about that. So that's where the practice aspect comes in. And I wanted to do podiatry practice management, but I asked Barry Block, and he runs podiatry management, and it was way too similar. And so I as a courtesy, I didn't want to call it the same thing. And so I was like, okay, well, what's another word? And I already had the domain registered with a podiatry PM. So I just picked mastery. And so what does mastery? I'm still kind of figuring it out. But what I think it means is constant and never ending improvement. It's not getting to a place, but it's a process that you're constantly on as a podiatrist or any person in general. I think we're always going towards mastery. And there's a couple of components. I think one is accountability with someone else. And that's where I think like a mastermind type of thing really helps people come to mastery. That's what residencies are basically, is where you can learn. But once you get out of residency, there's very few opportunities for that. So I hope to provide that community for developing mastery. And the few areas that I'm interested really are in terms of profitability and efficiency. So I think those are two key, because we're talking about practices. So you have to have a profit and you have to be efficient. Those are the two areas I'm really interested in. And then the accountability aspect as well.
Yeah. And I think, like you said, when it comes to the word mastery, if you think of martial arts in any way, and they'll say, yeah, when you get your black belt just means you've finally got to the level now where you can start learning, because you've learned the basics now. And that's why in a lot of martial arts, there'll be the master and then there's the grandmaster. It's this constant learning. Yeah. You don't know it all. And that's why they're a master. And then there's a grandmaster, and even the grandmaster is still learning and picking up new skills. But also when you touched on the whole thing about niching, and you said about just focusing in on podiatry, there's a lot of business coaches that will do podiatry, physiotherapy, chiropractic, but then all of a sudden they'll do some other professions as well outside of health. And yeah, I think the power is in staying in what you know better than anybody else. And therefore I think you can help people better as well.
I agree. There was a book I read recently. I'm trying to think of the name. It's not coming to me right now, but basically it talked about, I think it was the power of expertise, maybe one of these expertise books. And it talked about, I can't just be an expert at podiatry, because there's a lot of people that are a lot better at just podiatry. Okay. But if I'm an expert at podiatry, and I'm an expert at YouTube videos, and I'm an expert at podcasting and then business, then that having all those together makes me a kind of a special expert within one little niche area that I can help other people with. And that's the patient presentation aspect, where it kind of like, this is what I'm like, no one else is doing this. This is my little corner within the podiatry field. And so for these specific people, I think they would really be interested, because and basically when you want to be a master, or I think Dan Sullivan, who I go to for strategic coach, he uses the word, you want to be a hero to. So who do I want to be a hero to? It's that specific niche of people just like me, frankly, that we want to be the hero to people like us.
So, and that's a great segue into the other thing I want to talk to you about, which was what sparked my interest when we were talking on your video show, was about patient presentations. How I know a lot of dentists that use almost like PowerPoint presentations to explain treatments, and they are very elaborate and they spend a lot of time putting these together, but the results they get when it comes to explaining treatment and treatment plans is just over the top crazy successful.
Yeah, it's really been a practice changer, and I can tell you where it started from. I started to do patient presentations because I had a bad surgical outcome. And there was some type of an accusation that I didn't do a great pre-surgical discussion.
Okay.
So let me tell you what happened. And when something happens, we can say something happens to us, or we can take responsibility for it. And this is something that I've learned. I'm not naturally good at this. But then I thought, well, how can I take this bad experience? And if I could do it over again, what would I do differently? How can I flip it? I think taking any experience in life and trying to learn from it is the key.
Yeah.
And so what happened is I thought, well, if I could do it again, I probably would have had a really good, pre-surgical discussion. So that was the first patient presentation that I put together. And so every surgery I was doing, I had this really elaborate PowerPoint where I kind of went over what are the risks, what are the complications. You could get an amputation, you could have an infection, you could get MRSA, you're going to get a call from the hospital. I went over all of that, and it's just constantly evolved. And the neat thing about using Google Slides is where I have it is every time I get a new question, I can add it to my presentation. So it's always being mastered or perfected.
Okay. So you came up with the idea out of adversity, which is where some really, really good ideas come from.
It was really painful. Mm-hmm.
Yeah. So a painful experience, you turn that around. Instead of just wallowing in your misery and saying, why is this happening to me? You went, okay, how can I remedy this and what can I learn from it? And I think that is a really, really important point when the shit hits the fan. I don't know if you say that in America, when the shit hits the fan.
Yep. Same thing.
Good. Well, you got to expect at some stage in your career, it happens everyone, the shit will hit the fan with somebody. Something, but whether it's in your control or out of your control. But I think the key is to learn from it and don't make the same mistake twice.
Correct. Yeah. And if you take responsibility for it and what you can learn from it, we don't want to go into details, but you learn from it. And I learned a lot of things. And I made that presentation. I was then I also do a kind of an evaluation of, well, this last year, what have I been really liking in my practice? And I said, I really like these presentations.
Yeah.
And I was like, well, why don't I do one for plantar fasciitis? Because I liked it so much. And then that was the first other one I did was plantar fasciitis. And then I was like, wow, this is kind of fun. And then I did one on fungus. Then I went on neuromas. Then I did one on hammer toes. And I pretty much have one for everything I do. And the neat thing is I'll go into kind of how that benefits, if you'd like how it really, then it just grew. Because when we started practice, there was a group called the American Academy of Podiatric Practice Management. I was really involved in school, and then in probably residency, I got busy, and then I had a family, and I've just been busy ever since then.
Yeah, I was a member of that for a little while too.
Yeah. And one thing they teach you is they talk about something called scripts, or kind of like a canned spiel of how you explain things.
Yeah.
Right. And they also talked about a topic called in-office dispensing, or selling things. And then they also talked about kind of putting things together in packages. And what they never talked about was this patient presentation. Basically, I put all that together in one presentation. So basically, it is my canned spiel of how to do things. It includes all my in-office dispensing, and includes all my protocols of how I treat everything. So everything they taught me, I just put it in one little system that made it a lot easier for me to follow a script. Because what I found is that if you were one of my patients and I had 30 minutes, you would get my 30-minute plantar fasciitis presentation. But if I was 3 patients behind and I had 5 minutes, you would get my 5-minute plantar fasciitis explanation.
Okay.
And if I had an hour, you might get that hour presentation, but my presentation always varied on the amount of time. Okay. And also what I offered you, if I looked at you and I say, this guy doesn't have any hair, I don't really like him. I don't think he has anything. I wouldn't offer.
Oh, you're judging me because of my hair.
Just joking. I'm just joking. But if a lot of times we prejudge people. And so this guy, I'm not going to offer orthotics to. This guy, I'm not going to offer shockwave. This one, I'm not going to talk about amnio to, because I was either I didn't have the time or I was prejudging them. With a presentation, I can't get around it. Everyone gets the exact same presentation and they get the exact same opportunity for everything. So that was the next step, which really just made my life awesome. And I was like, wow, this is great. And then from there, it multiplied. I learned about making a checklist. So now everything has like a plantar fasciitis checklist. So at the end, or even in the middle, now I've moved the position of it, but I'm like, this is the checklist. This is everything that I use for 99% of my patients. Okay. In your specific case, we're going to do this and this and this. And then from there, it just blossomed. From those, I recorded YouTube videos with the same videos with voiceovers. I made books into them. I've made webinars for my patients. So then it just kind of blossoms into other stuff that just makes me so excited.
No, what I like about all that is when you said how you do the presentation will vary on how much time you have. Because one of the questions I was going to ask is, how do you fit this in amongst your patients? So you've answered that question, you modify it to suit. And I
I
remember,
don't. I'm
what's that?
sorry, I don't. I do not modify it to suit. That's the key.
But
So
wasn't
I
there
do
a
not.
5 minute presentation?
What I was
30
saying is
minutes, an
before
hour?
I had the presentations,
Yeah.
I used to give you the amount of time that I had.
Ah,
Now I
okay.
give the same presentation to everyone. Now, where I throw that checklist in and how much detail really depends on what you need, but I'm not skipping things. I used to
Oh,
skip
no, no,
things
that's
based
what I
on
meant.
time.
Yeah, no, that's
Yep,
exactly what I meant. So you're not skipping anything, but you can adjust. You can
I can
still tick the
adjust it.
boxes, but you can adjust it easily on what time you've got available to
Yep.
explain something. So, and I remember a speaker once said to me, I went along to a speaking retreat, and they said the best speakers are someone who's got a 40-minute presentation, and as they're walking up on stage, they'll get a whisper go, "Oh, by the way, you've now only got 20 minutes." And they'll just go, "Not a problem." They'll nod, and they can, without hesitation, take a 40-minute presentation, bring it
Yep.
down to a 20-minute presentation without skipping any slides and without skipping anything. Where they said some people get so set in how they present that they can't modify it. And therefore
Yeah.
they'll be told you've got 20 minutes, but they end up doing 40 minutes and they don't get invited back because they've run over time. So I think it's great what you're doing.
Yeah, I think frameworks. I think frameworks are
Yeah.
key, and you also you don't forget things, and it's all documented. You can document it, and you can give them a copy of it. I give all my patients a copy of it too.
Yeah, well, we did the same thing when we gave a treatment plan. I had it set out like a framework, a structure of
Mhm.
how it went. And as we went through certain things, you would circle certain areas in a particular time and a particular sequence. And you could spend more time doing it. You could slightly speed it up, but you always covered the important points. So at the end, the patient could never say, "You didn't tell me that." It was, and then they'd have a copy and we'd have a copy.
That's I like the idea of a kind of a checklist format. And I have one in my pocket that I've kind of made, which is similar. I don't know if you can see that.
I can see it. Yeah. Anyone on
Basically,
the
it's a
podcast can't see it, but anyone watching the video, this
yeah,
is why
it's
every now
it's
and then pop
basically
over to the video and watch it.
yeah, it's a foot treatment checklist. So basically it has these are the treatment modalities. Then I give this to my patient, very similar to yours.
Yeah.
What I like about the presentation though is I think some people are audio learners. So if I'm talking to them and I'm only talking, not everyone's going to connect. Some are visual and
Yeah.
some you actually need to do it on them or touch them or, show them an orthotic. And there's a lot of different ways of learning. So it seems to be working for me. So that's fun.
No, but I think it's good though. Like I said, I know dentists that because I was working with a dental company for a couple of years, learned a lot while I was there. But even working with the dentists and the dentists that are using presentations to explain a detailed treatment plan are succeeding far more than the ones that are not doing it.
I agree. I
So
agree.
I think it's an area of podiatry that is underutilized. We've got the technology to do it. It's just a little bit of time and effort of doing it. But once you've done it, you then just keep it. And it's also great that when you bring on an associate or somebody else working with you, this is how we present this problem.
Correct.
And they take it on from there.
Yeah, and it's primary cares when they come and visit or residents or different doctors, they can show them, they're amazed by it. They're like, wow, that's no, and the patients, what they say is, doctor, there's no one that's been so prepared for my visit. No one has gone in such detail and been so prepared. And they think I'm prepared for them. I'm really not. I'm prepared for the 20 diagnoses that I see over and over again, but I'm very prepared. And the neat thing is you can constantly tweak it. So you can, if there's a new question, you add it in there. If you're selling a new product, now we have focal shockwave or focused shockwave versus radial. And so I added that new device, and that's part of, I just tweak a couple of slides and then it adds it into the presentation.
So do you ever get any patients feel that like you're giving the presentation? Do you ever get any patients that will say, "Oh, is this the same presentation you give everybody?"
No one's ever asked that.
So, and then on the presentation, is there a name up there as you do the presentation, or it's just the presentation?
It's Google Slides. It's Google Slides. No, it's nothing specific to them. Now, and this is something I've learned from John Juliana, and I asked him the similar thing. It's about communication. So what I do is I do the presentation, and about 5 or 6 slides in, so I'll go over, basically I'll tell everyone, what you have, why you have it, and how much it's going to cost you in terms of time and money to kind of typically get rid of it. And then I have a checklist, and that's the checklist probably similar to what you used.
Yeah.
And then when I say, Mrs. Jones, in your specific case, it would best suit you to do this and this and this. That's where this checklist or this little thing I have in my pocket is. So I make it specific to every single patient.
Yeah, no, that makes sense. And John Julian has been on this podcast as well. So, and some of the stuff you were talking about earlier on about the whole self-reflection on what happened, Rob Herman was on my podcast, episode 56, and the episode was called Self-Reflection and Clinical Insights. And that all came about, same thing, where there was a surgery that went fine, but orthopedic surgeons were complaining about something that wasn't legit. But it made him have to go back and reflect on everything that he'd done going through that. But from that, the positives that came out the end of the self-reflection has paid dividends. And now he uses that to actually help educate and teach other people.
Yeah, I think our adversities really give us a lot to learn from. And there's a lot of different tools you can use. One that I use pretty much every single day. I always look at I do a couple of things, but what worked, what didn't work, and what would I do different? And what's the plan? I do that for every single aspect of my life.
That's a good aspect to take. I would say I don't do it on a daily basis, but it's probably a good question to ask yourself at the end of every day. What went well? What didn't work
go
well?
What would I do differently?
Go back, what would you do differently?
Yeah. And even if you just do one thing a day, what would I do? What's one thing I could, because when you say what's one thing I could do, you're taking responsibility.
Yeah, that's good.
Versus abdicating. Oh, it's my office manager should have done this, or someone else should know. What would you do? That's a hard thing, for us to take responsibility.
Yeah. When I had my practice, I used to say, even no matter what went wrong in the practice, I used to say it's my fault. Because even if the practice manager or the senior receptionist or one of the podiatrists, something totally stuff up, you could trace it back to, did I train them properly? Did I retrain them properly? Did I remind them of how something should have happened?
Yeah.
Did they forget? Should this have been brought up at a recent cleaning? Has it happened in the past? And why did it happen again? So there's no point just pointing at somebody in your team saying, you stuffed up, you have to fix this. Yeah, they do have to fix it.
Mm-hmm.
But you also have to take part of the responsibility as the business owner. You can't point at other people all the time.
Yeah. I think that's fabulous advice.
Yeah. I had a podiatrist work with me, and there were a couple of times where things went wrong, and you'd sort of go, oh, I've told them this 3 or 4 times. This is how they should do it. But then all of a sudden you realize, okay, I may have told them, but have I shown them? Mm-hmm. And then have I shown them again? And when you sort of think about that, you go, okay, maybe I haven't. This is what we need to do. And when you realize that you're part of the problem, you're also then going to be part of the solution. And then I think things fix up a lot easier.
I think the same thing in terms of with patients. I tell them, and they don't hear and they don't remember what I tell them. I've just done a beautiful presentation. Yeah. Okay. And I'm super proud of my presentation, but they're concerned about themselves. They're concerned about the needle they're going to get in their foot. They're concerned about their finances, if they're going to afford it. They don't hear anything. So I think no matter what you do, you have to have some type of follow-up education. We use something called Patient Education Genius. I don't know if you're familiar with it. Basically, it hooks into our medical record. And I put all basically, if I'm giving a presentation, I'll send them a video recording of that if they want to review it. I might send them a PDF of a book.
I was going to ask that.
So I've made all these things into books and videos as well. It just replaces myself. So I explain it once and I'll say, Mrs. Jones, you may not have understood everything I said, but I'd like to give you this video you can review at home, or a book, however you'd like to learn about it. And they can take that. And the cool thing about Patient Education Genius, if I send it to them, it also sends them has a little chat bot, say, hey, give us an online review. That's how we get so many online reviews. So it's kind of a neat thing. So I'm sending out patient education to everyone and they're giving me online reviews. But I think that the continuity, and one thing I've been working on this little form I have here, it has something here, basically what's helped, what hasn't helped, and what do you think you could do different, right? So that same question I asked myself,
Yeah.
but it also has a treatment tracker, and I haven't figured out anything. Maybe I could use your help for it. But what I feel like is patients, I learned this from a dermatologist. If someone has a really bad like eczema or dermatitis, what's the best way to get them to use their steroid cream? You know what that is?
No.
Have them come back every day because they're going to use it. If you see them a week later,
Yeah.
there's a trend. They use it more when they leave and right before they come back. So the more frequently you can see people, the more consistent they are going to be with their foam rolling, with their stretching, with their icing, with their anti-inflammatories.
Oh,
so
definitely.
I'm trying to figure out a way of making a tracking, like a little journal. If I could find or buy a $1 journal to give to everyone where I could have them track a few things for the next 3 months, that would be great. And I could say, okay, take your anti-inflammatories, or we do a lot of foam rolling. We do a lot of, icing or stretching and things like that. So you could put all those in there. So you give them homework. I think that's the key. My kids do Kumon, which is that math and reading thing where they do it at home.
Yeah.
That the key is that consistency of the tracking. And I think a lot of our patients don't get better because they're lazy like we are. I'm lazy. But if you give me something I have to track, and even better yet, if you pay me, I'm going to tell you a little secret here. We're going to do a webinar coming up and on like how to do webinars, right, for your patients. Because all these presentations, I've turned them into webinars, right? And so I do them for all my patients. I send it out to my list and I record them. But I'm going to teach podiatrists. And so I'm thinking I'm going to do it for free and things like that. I said, you know what I'm going to do? I'm going to have them pay, like, let's say, I don't know, $97 or $197. But if you actually fulfill in 30 days, I'm going to give you your money back, or I'll give it to a charity. Because it's not about the money, it's about people taking action. I think both our patients have a hard time taking action, and podiatrists, we as well have a hard time taking action. So, I think whatever we do, if we can incentivize them to do it.
That is brilliant. So what you're saying is you'll charge, say, for example, $197. They do the webinar to learn about how to do webinars for their patients. And if they put a webinar together and they show you, I've done this webinar
in 30 days, and they make a Zoom recording, I'll give it to them for free. I'll refund their money. Or I'll donate it to a charity. Why not? Wouldn't you do that?
That is fantastic. That is a great idea.
But because you want them to take action.
I would give them back 50%, but
maybe I haven't decided yet. I'm just thinking, so maybe we'll change it.
But I think that is a really good idea to get people to take action, because so many times people do a course, do an online course, they do something and they don't take action.
They don't, and you give it to them for free, they're not going to do anything. They won't even watch it.
They'll do nothing.
But if they pay $97, maybe they watch it. But if you say, I'll give you the money back, maybe a little bit more. I don't know. We'll see. I'm just trying things. But I think of me. And
It's true what you said about tracking, though, because I know when I've been doing certain things, say with a business coach in the past, and you'll finish with them that day and you're all excited. So you'll do some work that day. And then the next day you get busy, somebody else comes up, and then all of a sudden you go, oh, I've got to talk to them again on Wednesday. So Wednesday morning, you start doing a whole pile of stuff. So you're doing things straight after, you're doing things right beforehand, but there's a big dip.
We're no different. We're no different.
So you're trying to find a way that you can track it with your patients.
So that's where, yeah. So I'm thinking, well, how can I do it? I know my daughter, she has for Kumon, she has to do her 3 or 4 pages of Kumon reading and math a day, and it's tracked and how many errors, because what's tracked really improves.
Yeah.
And so for my patients, if I could have this little booklet, and I've done it on here, but no one really brings it back to me. But if I could, almost like with the diabetics, they check their blood sugar every day. I'm going to give them a little book, and they're going to love that, just like their blood sugar book, and they're going to track and how they're doing and what number they give themselves, and they can come back. I think that would make the accountability. I'm always trying to improve things for my patients and help them get better faster in spite of themselves.
I think it's what you've done is you've just improved the pathways of communication. And like you said, some people are auditory, some people are visual. And what is the other? Kinesthetics. Of some people, they want to be touched or something like that. It's more of a feeling. So, but you're just improving the pathways of communicating with your patients backwards and forwards. I know just before I started my practice, we were putting together audio, because I like audio. We were putting together audio recordings. And the idea was that you gave somebody an orthotic, you ran through the instructions, and they're going to remember nothing. So the idea was to do a CD and say, do you have a CD player in your car? Yes. Put this in your car when you drive home. and it's pretty much a replay of what I just told them in the room.
That's great.
You can do it for nail surgery. You can do it for different procedures, things that, the instructions you tell them after nail surgery. Listen to this on the way home. Now, I did have someone say, oh, I'm more into MP3s. I don't have a CD player. Well, then we put the MP3s on the website, download. But the thing is, they've got more chance of doing it as soon as they get in the car and putting the CD in. And most cars still have CD players.
Yeah, I'm kind of a techie. So if any of the podiatrists that are listening want to consider doing that, a really easy way is you go to anchor.fm.
Yeah.
And you do a little podcast for your clinic, and you put in audios of all the instructions, and you just send them an SMS message after they leave with that individual audio.
Yeah.
And they can go right to their...
Yeah. Do it on Podbean. There's a number of free...
Podbean's a free one as well. Yep.
There's a number of free audio programs where I use it on my website. I've got some audio things on my website, and I use Podbean just to put them up there, because you can do a certain amount for free, up to 5 hours recordings for free, broken into as many little episodes as you want. So to have all your instructions done, you can have it on Podbean, and it pretty much costs you nothing.
That's great.
And that would be another way of actually doing it. But
I think multiplying to save time and helping our patients is key.
When you said before, too, patients don't hear everything you say. Have you ever seen that video, the moonwalking bear? Now, see if you can Google it. It's the moonwalking bear. So all of a sudden there's a video, and there's like 7 guys standing with a basketball. It says,
oh yes, I've seen that with the gorilla. Mm-hmm.
Yeah. Oh yeah. Moonwalking gorilla, whatever. And I've seen different versions, and they said, follow the ball. So you see them throwing the ball to each other, yelling at each other. And because you're focusing on the ball so much, all of a sudden a person wearing a gorilla costume moonwalks through the middle of them and disappears.
Yeah, I've seen that.
Did you see the moonwalking gorilla, moonwalking bear? And you go, no. And then you go back and watch it, and you go, my God, how did I know that? And I think that happens with their patients. Like you said, you're talking, they're focusing on something else, and all they're hearing is blah, 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 blah.
Am I going to get that shot in my foot, or do I have to have surgery, or is this infection going to go away, or anything like that?
You're talking about fees. It could easily be they're going, you're talking about the cost of doing the procedure, and in their head they're going, oh, geez, got mortgage repayment coming up, car repayment. My son's going to get new braces. And while they're having this conversation in their head, they're not really hearing what you're saying.
Yeah.
So what you're saying is the moonwalking gorilla. Then giving them the information afterwards is pointing out, did you see the moonwalking gorilla? And then they listen in their own time.
And if you do coaching, Tyson, you have to listen to things 3, 4, 5, 6, 7 times, pay for it again, different versions before you'll finally get it. Imagine our patients. We've explained plantar fasciitis 50 times, or a week, but they haven't heard it, and they're not going to get it. You can't assume your patient's going to understand anything the first time. Yeah. One of my friends here, Neil Feldman, my partner, he always says, yeah, the patients come in, I tell them all about plantar fasciitis, and they leave and they think I called them fat. That's not, but that's what they're thinking coming in. Is it because I'm fat? That's why I got plantar fasciitis. No, I didn't even touch that topic, but they're in their own mind and thinking in their paradigm is how they see things, their prism.
Yeah, I did. There was a podiatrist that I spoke to, and they said that when they're talking to patients, that they actually are looking at the whole aspect of them as well. That what is their weight, and what are the other aspects that are part of the problem they're presenting with. So when he's putting together the treatment plan, he also includes other things about diet and exercise and bringing the body weight down at the same time while they're doing other treatment. And he also presented it in a booklet.
Yeah, I think I've had, like, the only patients that have really cried lately when they come back to see me are the ones that I've been able to help with the nutritional aspects. And I have a little way of saying it when I get them better from one condition. I say, Mrs. Jones, if we were meeting here a year from now, what would you like to happen with your health? What are your goals for your health, or what are you looking for? Yeah. And 100% say they want to lose weight. And so, I have a few tips and techniques that I lecture about, or I have different videos on that I can give them that work really well. So I'm that, and they come in and they cry. They're 50, 60 pounds lighter when they come and see me. I'm afraid I'm going to get sued, but I am really helping people, and they're getting better. So,
but I think we're not dietitians.
Not.
But I think there's no harm in pointing out to a patient that maybe you should have a look at your diet. You know,
I think we're obliged to do that.
yeah, maybe you should look at your diet. Maybe you should exercise more. And if you do have a dietitian that you're friendly with and you have a good working relationship with, maybe you do a referral to the dietitian. And the dietitian at the same time, I'm sure they get patients that are overweight who have foot problems. So why we used to have a really good relationship with a dietitian in Cairns for a number of years, and the referrals did go backwards and forwards. So to me, that's an area that podiatrists don't need to be giving dietary advice, but need to be pointing it out to a patient and then directing on where they can get help.
Yeah. And you have to exactly where they have to figure out, it's motivational interviewing. We're not trained at all in motivational interviewing, but I think it's key finding out what they really want to do. What are their goals? And I learned this from over there in England. One of the Paul. He's
that other part of Australia.
Yeah,
England.
the other part. Yeah, Paul Hosborough. I think he does the shockwave stuff.
Yeah.
And he's got a neat way of explaining where he talks about like, how is this affecting you? Asking our patients, like, how does this plantar fasciitis affect you? Like really get into it. And a lot of times they can't play with their grandkids, and you really want to go into and say, well, and you just kind of go deeper and deeper. And by the time they get done with you, they're crying and there's these other issues, and it really affects them. Like we don't realize how their feet really, really affect them in a lot of ways.
Yeah. The whole and technique, Dave Freeze, with the business black ops, talks about that a lot. So whenever you ask a patient a question, usually the first thing they tell you is a lie. And that's a bit blunt, but he said, but if they say to you, oh, yeah, so how can I help you today? And they go, oh, my heels are sore. You go, and you pause. And it might feel like that 3 or 4 seconds that you're pausing seems like a lifetime. They said, but it's only 3 or 4 seconds. And you just pause and go, and then they'll go, oh, and it's affecting me. I can't walk as far as I used to walk. In fact, some days I can't walk because it's too painful. And anything else? And they'll go, oh, and I can't take the dog walking. And then as you dig deeper, they're actually more concerned about the dog getting fat because they're not walking the dog anymore. And it's a part of their day they enjoyed. So it's Peter Wishney says it best. I don't know if you know Peter Wishney at all, but he's been on the podcast, and he says, we don't just treat feet, we give people their lives back. So I just think that it's just so good. We actually give people their lives back. We're not just treating feet.
Yeah. I think that's key. When we're, you can really be a hero to people. And I think that's really helpful.
So I've learned heaps today. I'm glad we talked about patient presentations because it's an area we haven't spoken about. So before we finish up, have you got one thing? How can people contact or connect with you if they want to reach out, learn a bit more about you, about your videos and other things that you're doing?
Yeah, the best way would be podiatrypracticemastery.com. Basically, that's where you can just put your name and email. You'll get access to these, I call them strategic sessions. Basically, we're going to go over different topics. The next one will be on webinars, but every month there'll be something out, and then you'll get all the other information there. That's where you can contact me.
Okay, cool. So before we go, I want one final tip from you. Some words of wisdom that we can finish up on.
So the words of wisdom I would say is always be learning. Yeah. So however you want to do that, it could be, I do Audible, I get coached. You always have to learn and improve yourself. You have to work harder on yourself. This isn't my quote, but you have to work harder on yourself than anything else. Yeah.
Be a sponge. I'm always just, I was talking to Simon Bartol recently, and his podcast, the last podcast episode that he was on, and he just said that why he does what he does, he just loves learning, learning new stuff every week. It's just, he gets such a thrill out of learning and then gets a bigger thrill out of teaching what he's learned to other people. And I think that's why, and you're probably exactly the same. Yep. That's why I'm always reading books, listening to podcasts, doing online, small courses, is because I love just learning new stuff. And then I love sharing it with the podiatrists that I do coaching with.
I agree. I think I'm the same way. I love learning, and I love helping others to apply it, and maybe taking a shortcut, right? Because it's taken you so much time to do that, and you suffered so much trying to do it, and you just want to help others do it quicker. No,
I think there's a great way to finish. So, Don, I want to thank you for coming on the Podiatry Legends podcast, sharing your wisdom, talking about everything that you've been doing, and like I've said on a lot of podcasts, if you listen to this and you did not get anything from it, give yourself an uppercut, or go and sit down, take a couple of Panadol and lie down, and then get back up and listen to it again, because there was so much valuable information in this that I think, it's the ideas that you were talking about is something that I think a lot of people can benefit from.
Thank you, Tyson. I think the key isn't so much learning, it's applying. I think taking action is really the challenge. You could listen to this 10 times, but people that don't take action don't do anything with it.
Jeez, just full of wisdom. That is good too. Yes. Action. It is all about, it is about taking action. You can learn it, but if you don't apply it, and it's only when you do the actions that you get a result, and then you can modify it and take more action.
Yeah, you can watch. I got, so we've been stuck here in the States with COVID. We can't go to the gym anymore. So I got the Beachbody thing. I could watch Insanity every day for 40 minutes, but it's not going to help me get in shape. These workouts, you have to apply, you have to take action, right? With anything we're talking about. And I think people struggle. We can maybe talk later about that, but how do you make forward progress in your life? It's not as easy as you think it is. Otherwise, everyone would be superstars, but we can talk about that later.
Oh, definitely. If everything was easy, I would have this rip-roaring six-pack, and I'd be doing this podcast with no shirt on. And I would look better than the cover of my book. I wouldn't look as old as what I do now. So anybody who ever gets a copy of my book, It's No Secret There's Money in Podiatry, and you look at the cover, it is an old photo now. I don't look anything like that anymore. I had more hair back then. So just thought I'd point that as my disclaimer. So, Don, thanks again for coming on. It's been great.
Okay, thank you, Tyson. Have a great one.
Yeah, you too.